If your period is late and you see a negative on that pregnancy test, you're probably feeling confused and anxious. Many parents feel exactly the same way. Doctors say this situation is surprisingly common, and it doesn't necessarily mean the test is wrong or there's something wrong with you. By the end of this video, you'll understand exactly how pregnancy tests work, when to take one to avoid false negatives, and what to do next.
Your body produces a hormone called HCG when a pregnancy begins. A home pregnancy test measures HCG in your urine to check for pregnancy. About 7 to 10 days after fertilization, HCG can first be detected, but it starts at a very low level. Each day, it roughly doubles. So by the time you miss a period, HCG is often high enough to trigger a positive result on most tests. In fact, health reports note levels frequently exceed 100 MIU per milliliter by your missed period.
This is where many people get confused. If you test too early, the test may not see the hormone yet. The FDA explains it clearly. If you test too early, your placenta not had enough time to produce HCG. This would mean that you are pregnant, but you got a negative test result. In plain words, a negative result before your missed period is usually because HCG just isn't high enough yet, not because something is wrong.
It's normal. Doctors reassured that a negative too soon is not a final answer, it's just too soon to tell. So, for accurate results, experts recommend waiting until at least 1 to 2 weeks after you miss your period. This gives HCG time to rise. In fact, the FDA notes that up to 10 to 20 out of 100 women won't detect pregnancy on the very first day of a missed period. If you have an irregular cycle, you might need to wait even longer. For example, one UK source suggests testing at least 3 weeks after unprotected sex if you're unsure about timing. When you do test, use first morning urine if you can, because first morning urine contains the highest concentration of HCG. So test right after you wake up, and try not to drink too much first. That way you won't dilute the hormone. Follow the test instructions exactly. Use the timer, check the control line. Doing all this helps avoid a false negative because you'll have the strongest possible sample for the test to read.
Here's the part most people misunderstand. If you took a test early and it was negative, don't panic. Doctors say, a negative result now is tentative, not the final word. If your period still doesn't come, wait a few more days and test again.
Your HCG doubles very quickly in early pregnancy. Studies and guides suggest that repeating the test a week later often turns a negative into a positive once your hormone level has had time to catch up. In fact, one patient information site advises if you continue to have symptoms or no period, take another test in a week's time. It can help to remember many couples experience false negatives at first. You might have seen websites or ads promising early detection, but every test is limited by how much HCG you've produced. Even the most sensitive home tests can't show positive if the hormone isn't there yet. So treat a negative test before your missed period as an early sign, not a diagnosis. Doctors often remind patients that a home test is only a first hint. Only a healthcare provider, perhaps with a blood test, can give a definite diagnosis later. That said, most positive results really do mean pregnancy. If you do ever see a positive, even a faint line, it's usually a good indication of HCG. We'll cover faint versus evaporation lines in another video. For now, focus on timing. If it's still too early, a negative result may simply mean try again later. While false negatives are often normal, there are some rare situations where you should contact a doctor right away.
For example, an ectopic pregnancy can produce lower HCG levels, so a home test might stay negative even if you are pregnant.
We will also discuss detail about ectopic pregnancy and how to resolve this in an upcoming video. So if you have severe one-sided pelvic pain, dizziness, or heavy bleeding, those are not typical and warrant medical attention. In general, if you test negative but your period is extremely late, or if you have worrying symptoms like intense pain or heavy spotting, call your doctor. It's always safer to check, but remember, these serious conditions are uncommon. Here's something to keep in mind. You are not alone. Many parents-to-be go through the same confusion, and there's a clear medical reason for it. Your anxiety is understandable, but try to take care of yourself. Eat well, rest, and keep track of your cycle. If you did test negative and feel upset, remember it's often just timing. When the time is right, a retest usually gives you the answer. So, at the end, the summary is, pregnancy tests work by detecting the pregnancy hormone HCG, which takes time to build up. For most accuracy, wait about a week after your missed period to test, and use the first urine of the morning. If you test too early and see a negative, it probably just means not enough HCG yet, not no baby. In that case, simply wait a few days and test again. Focus on what you can control, tracking dates and taking gentle care of yourself. Doctors assure us this confusion is common and usually resolves with time. If you found this helpful, consider subscribing for more pregnancy tips. We have a series on understanding tests and early signs. Up next, we'll discuss faint positive lines versus evaporation lines on tests, another common source of confusion. Stay calm and remember, you're not alone in this journey.